Chris Johnson here. Today I wanted to talk about shin splints. So it's marathon season here in New York, and I figured this would be a timely post. And I also had a friend in Austin, Texas reach out, and she wanted to get my clinical approach to addressing shin splints because she mentioned she's having a lot of runners come in, and I think she's suffering from it as well. So let's start by saying that shin splints is really a blanket term. It's like saying someone has shoulder impingement. That can mean a few different things. So the area that's typically affected is what's called this pre-tibial region. So if we come down here on the leg, it's basically if we identify the tibia, which is the large bone in the leg, all right, we're talking about this area just off to the left in this case, or lateral to the tibia. And these muscles are subjected to a lot of load because if we think of walking, when we walk, we strike with our heel, we go to a foot flat position and then toe off. Okay? So when we go from heel strike to foot flat, these pre-tibial muscles have to handle that load, and they're what's called eccentrically contracting as they control the foot going to the ground, and then you have to toe off. So obviously we're walking around a lot during the day. I know in New York I feel like I cover 5 miles every day. And if you throw running on top of that, especially if you're a heel striker, the stage is set for these tissues to get really disorganized and for a lot of adhesions to develop here. So when it comes to approaching this, what I like to do is to incorporate a lacrosse ball and to get the patient actively moving in conjunction with it. So what it's going to look like is this. Once we identify the tibial shaft right here, I'm going to basically start high, a little bit lower from this bump, which is where the patellar tendon comes down and inserts. So I'm just off to the side of that right there, okay? And I'm going to anchor down, and then once I have this in place, and again, the lacrosse ball is nice because you get good friction, it doesn't slide off the skin. I'm going to have the patient plantar flex or point the foot away, and then dorsiflex or pull the foot towards them. And I'm just going to have them repeat that 10 times. Alright, so say 10 have passed, then I'll basically work down 1 more inch. Okay, and I'm going to do this the entire length of the leg until I get down to the very distal point of the leg. Alright, so the only thing you have to be careful of is if you start having any weird symptoms, any tingling or numbness, you do have to be mindful that the superficial perineal nerve is here. I know that's a mouthful, so just remember, if you start getting any weird tingling or numbness, take a break because you're probably putting some pressure over the nerve. It's a little bit less of an issue the further down you get. And when it comes to a home program, I have all of my patients get a lacrosse ball. I actually give it to them. I give away everything, it seems. So anyways, I give them a lacrosse ball, and most people have a sofa and spend too much time on the sofa. So I say if you're watching TV, just go to the end of the sofa, anchor this lacrosse ball on the arm of the sofa, okay? And that way you can replicate this technique at home. And I find this sometimes to be even more effective. All right, so because now we have a little bit of body weight, and again, you're going to plantar flex and dorsiflex, working inch by inch down. Okay, so don't forget about the pre-tibial muscles. Everyone's focused on the calf, which is understandable, but you also got to give the pre-tibial muscles some love and make sure you get them freed up. And you'll be thankful that you did, and hopefully this keeps you on the road running.